Don't even get me started on breaking bones in your face to hopefully allow them to heal a particular way. Don't do that. When you think about what's underneath the skin, it's not just a muscle. There is absolutely no benefit that massaging your face will improve toxins. If you don't have the money for that, cheapest sunscreen, still better than not wearing sunscreen at all. Is facial massage gonna work for you? I think you probably have the answer if you're here, but let me tell you why. If you should do it, if you shouldn't, if you're gonna get anything out of it. And maybe a little bit about anatomy so that you understand the benefits or the downfalls of doing these types of treatments. Don't forget to like, subscribe, and follow for more cosmetic and aesthetic content. And let's get into it. So first things first, the muscles of your face. If you think about your bicep, and I know I've got a huge one here, your bicep attaches from one bone to the next. So it attaches, or I should say across a bone. It is a muscle that bears weight. So when you lift things, it has to be able to withstand that weight. It's got very thick tendons so they don't tear. But that is a muscle that is very different than the muscles of your face. Your face muscles attach from the bone to your skin so that when you raise your eyebrows or smile, your skin moves, and these are facial expression muscles. The difference of your face is that those muscles are wrapped in another layer and in multiple layers of tissue with fat pads, with different types of ligaments, with a layer called the SMAS layer. And so when you think about what's underneath the skin, it's not just a muscle like it is in your bicep that has, yes, other layers, but nothing compared to your face. So the point being here is that the anatomy of the face is very different than the anatomy of other parts of your body. The second thing is, what is the goal of massage? I've seen people, do this to try and smooth wrinkles out, do this to try and lift their face. The issue is that it's not necessarily that the muscles of the face are weak, right? We think that if there's sagginess in the face, if there's laxity, if there's volume loss, that now it's because the muscles are weak. That's not the case. Descent of tissue coming down, and muscle looking like it's weak can actually be a function of muscle being on tension. If you see people whose necks are low, that muscle is actually on tension, and it can be improved by Botox. So if you imagine, Botox weakens your muscle. When we put Botox in the neck, it actually can make the neck look a little bit better. So if strengthening the muscle was the way to do that, then Botox would not work. So that's one way to think about it. But when people think about massaging tension out of their face, trying to strengthen facial muscles, there can be a benefit, but let's first talk about why it's not beneficial. Number one, wrinkles. So massaging is not going to iron out wrinkles. Wrinkles are not caused like they are in paper. Repetitive movement over time with sun damage and loss of collagen will create wrinkles in the skin, especially in the forehead where those are dynamic areas. And if you raise your brows enough, you are going to develop lines there. No amount of massage will iron those wrinkles out. If you train your forehead to not move when you talk, if you talk like this without raising your eyebrows, you can minimize those wrinkles, but massaging it just doesn't do anything to minimize that. Tape, also similar thing. It will train and splint that muscle, but if you're not wearing the tape and you are still moving it, you're gonna have the same problem over time. So unfortunately, even if you get a facelift, Botox is what people do for those lines. For fine lines and wrinkles on the face, skincare, sunscreen, lasers, etc. If you don't have the money for that, cheapest sunscreen, still better than not wearing sunscreen at all, and still probably the best skincare ingredient that you can use on your face. But I digress. The main thing is massage. Massage can feel nice. People think that it increases blood flow because your skin is rosy right away. Sure, a little bit, but for wrinkles, it's not going to iron them out. Number two is laxity. Facial massage has no benefit, has never been shown to have benefit with facial laxity, at least on a level that is noticeable to the naked eye. Now, there might be small studies that show skin improvement. There might be small studies that show that there's a little bit of hydration or blood flow, but nothing appreciable. And I say that only because I'm not trying to convince you to have surgery. I'm just trying to say you could spend minutes or hours every single day doing this to your face in hopes of achieving a particular result, or you could think of it as why waste the time and why not do what's going to actually show a significant result in exchange for the time that you would spend massaging, right? It's one way to think about it. You guys should age however you want to age. There's no right way around it. The third is quality of the skin. There is absolutely no benefit that massaging your face will improve toxins or improve the quality of your skin, pigmentation, or anything related to that. That is because collagen breakdown, pigmentation from either trauma to the skin, sun damage, or loss of collagen, all of these things accumulate with time, and massaging it, simply doing this, is not going to do it. It's the same reason why massaging your scalp doesn't necessarily regrow your hair. It can be beneficial, but it's not going to regrow hair. That's not to say that massage is useless. So where can massage be helpful? If you've had surgery, massage can help actually break up scar tissue. So I frequently have patients massage their eyelids, massage under their chin or their facelift scars. That can help break up scar tissue. If you've just had surgery also and fluid can accumulate before your body figures out how to take care of it, massaging can help drain some of that fluid and encourage it to go away. But it isn't going to change your surgical result for the most part. It's not going to make, again, fine lines, wrinkles go away, and it's definitely not going to change the structure of your face. You've got bone, you've got soft tissue, including muscles, skin in multiple layers, ligaments, all of the things that make your face your own unique face, and simply taking some pressure and putting it on there, not a thing. And don't even get me started on breaking bones in your face to hopefully allow them to heal a particular way. Don't do that. So if you're interested in learning more about facial aesthetics, like, subscribe, and follow, and I'll see you next time.